Everyone, let's just begin the diuretics revision for the upcoming FMGE exam. So the diuretics, what they are doing, they will basically inhibit the reabsorption of the sodium. Okay, so what is happening when the sodium reabsorption is inhibited? What will happen? There will be more loss of sodium and water, hence there will be more urination. Okay, now there are luminal side and the basolateral side. Okay, luminal side, for example, this one is blood vessel and this one is like a collecting duct or maybe PCT. Okay, so what is exactly happening over here? So this layer is known as the basolateral because it is a blood side. Okay, and this layer is known as the luminal side because it is a urine side. Okay, then the diuretics are further categorized into groups. Okay, so number one is the loop diuretics group. In that, the most commonly drug which is asked is the furosemide, which comes under the brand name Lexic, and it will act on loop of Henle. Okay, then comes the thiazide diuretics. For example, most commonly drug asked is the hydrochlorothiazide or the chlorothiazide, and they will act on DCT. Then comes the aldosterone inhibitor, like for example spironolactone, and they will do what? They are potassium sparing diuretics and they will act on collecting ducts. Okay, they will act on collecting ducts. Okay, then comes the ENaC inhibitor. The ENaC inhibitor example is amiloride, it will act on the collecting duct. Then comes the carbonic anhydride inhibitor, like for example most commonly asked us, this one is the acetazolamide, which act on the which we give in case of mountain sickness. Okay, and this carbonic anhydrase inhibitor will act on the PCT. Okay, then comes this one, osmotic diuretic. Basically the most common example is mannitol and it will act on PCT, but more oftenly it act on loop of Henle. They ask this one. Okay, then comes our the loop diuretics, which is also known as the high ceiling diuretics, and they will act on thick part of ascending loop of Henle. They inhibit the sodium, potassium and chloride importer system. What exactly these loop diuretics are doing? They will do vasodilation. Suppose this is vessels and the vessel got dilated. Now what will happen? The prostaglandin release when the vessels are dilated. Okay, hence there will be more vasodilation. Okay, so because of excessive release of prostaglandin, there will be more dilation. Okay, so that's we need to remember, though there will be when they are released there will be more vasodilation. Okay, and this is seen in case of thiazide diuretic also. Okay, now another thing is that, for example, there is NSAIDs. For example, NSAID paracetamol. Okay, so for example this NSAIDs group decrease the prostaglandin, so it will decrease the effect of the loop diuretic or the thiazide diuretic. So when we are giving loop diuretic or thiazide diuretic, it's better to avoid the NSAID because they will decrease their effect. Okay, then comes our ethacrynic acid. Now ethacrynic acid, the most important key feature is that it is most ototoxic. It is what? It is most ototoxic. Okay, then let's talk about the uses of the loop diuretics. So the drug of choice for pulmonary edema, if there is pulmonary edema, the drug of choice is furosemide. Okay, furosemide. And another thing is that if the patient has renal failure, then again the diuretic of choice is furosemide. Okay, then another example is, for example, thiazide is ineffective. Okay, in case of renal failure, if we can't give the thiazide because that is ineffective, there is no use. Okay, except one drug, that is the metolazone. Okay, then the side effect of loop diuretic is that, for example, the mnemonic loops loses all. Okay, this is the easiest mnemonic I have found. Okay, now what does it mean? It loses what? It loses sodium, potassium, chloride, calcium, magnesium. So there will be like hyponatremia, there will be hypokalemia, hypochloridemia, hypocalcemia. Okay, now another side effect will be they will increase the uricemia. Okay, that means they will increase the uric acid. So better to be avoided in case of gout, better to be avoided in case of diabetes also because it's increased the glycemia, and better to be avoided in the lipid pathology case also because it's increased the lipidemia as a side effect. The another side effect is the metabolic alkalosis. Okay, that's we need to remember. Then comes our another topic, that is the another group, that is the thiazide diuretics. Thiazide diuretics is also known as the moderate efficiency diuretic. Okay, now the another thing is that it will act on the proximal part of the DCT. It will act on which part? Proximal part of DCT. Hence it will inhibit what? It will inhibit sodium chloride importer. Okay, now one key feature is that it is not effective when the GFR is 30 or 40, means below this level. Okay, if the GFR falls below this number, then we can't give these diuretics because they are not effective in that case. Okay, then the thiazide diuretics they are used in case of hypertension. Suppose if the examiner asks what is the diuretic drug of choice in case of hypertension, then we will answer it is the thiazide diuretics. Okay, also we use it in case of calcium stones or other there is like treatment of the nephrogenic diabetic insipidus, it can also be used. Now the thiazide diuretic side effect can be, it's like the side effects are same as loop diuretic except one thing, that in loop diuretics there was decrease in the calcium. Okay, there was hypocalcemia, but because this thiazide diuretic saves the calcium, then this will not be there, there will be hypercalcemia over here. Okay, that is the difference between these like loop and thiazide diuretics. Okay, then another one is this one, that is the potassium sparing diuretics, divided into two category, aldosterone inhibitor or ENaC inhibitor. Okay, now basically they will act on the collecting duct, they inhibit the sodium potassium antiport system. Okay, all diuretics will act on luminal side. Okay, except what, except this aldosterone inhibitor, they will act on basolateral side. They can ask this. I'm sorry. Sorry. So this one. Okay, actually I'm speaking very fast, so that's why I got sudden cough, I'm sorry. So anyways, so this they can ask that all diuretic will act on the luminal side. Okay, except the aldosterone inhibitor which will act on the basolateral side. Then let's talk about the potassium diuretic use. For example, the spironolactone, the use is like, for example, they are the drug of choice for the edema which is due to cirrhosis. Okay, if the edema is due to cirrhosis, the drug of choice will be spironolactone. Then another one is like, for example, in the Cohn syndrome also we can use the spironolactone. Why? So because in Cohn syndrome there is excessive aldosterone, right? The condition is that there is excessive aldosterone, so because of that we have to inhibit that aldosterone, so that's why we will give the spironolactone in the Cohn syndrome also, right? Then comes this one, that is the like amiloride. Amiloride is like ENaC inhibitor. It is the drug of choice for the lithium induced diabetic insipidus. So when there is diabetic insipidus due to lithium, or if there is like a Liddle syndrome, we will gonna give this amiloride which is ENaC inhibitor. Now one concept we need to understand, that aldosterone like present in the blood, it will act on the ENaC channel. Then what will happen, it will save the sodium excretion. Okay, it will save the sodium excretion. Ultimately water is also get saved, which means there is more like there will be more water and sodium inside the body because it is saving it, and it will excrete the potassium and the hydrogen. Okay, so that's why if you are giving its inhibitor, these things which will not happen. Okay, and there will be release of water and the sodium also. So that's how the Cohn syndrome, not Cohn syndrome, any other condition also Cohn syndrome also, like that's how they get cured. Okay, if we give aldosterone inhibitor. Then there are certain drugs, they often ask this question, that tell us which drug is which drug can cause the gynecomastia. For example, digoxin can cause isoniazid, spironolactone, cimetidine, ketoprolol and estrogen. And we can remember by the mnemonic DISCO. Okay, digoxin, isoniazid, spironolactone, cimetidine, ketoprolol, okay, and the estrogen, we can remember that. Okay, then comes the carbonic anhydrase inhibitors. Basically the carbonic anhydrase inhibitor, one of the example I have told, that is the acetazolamide. The side effect, it can cause acid, see acetazolamide and acid. Okay, so and it makes urine alkaline. The use I have told, that is it is used in case of the mountain sickness, it is a drug of choice in case of mountain sickness. Okay, and the side effect is metabolic acidosis. It causes what? It causes the metabolic acidosis. Then in the acute angle closure glaucoma, first we give the IV acetazolamide, or instead of that we can give mannitol. After that we can give the pilocarpine, which is a drug of choice. Okay, then comes the osmotic diuretics. In osmotic diuretics there is mannitol, which is the drug of choice for the cerebral edema. Okay, and in case of like again acute angle closure glaucoma. Okay, now if we are talk about the like diuretic of choice, okay, then mannitol. Okay, then there are some antidiuretics. So normally, suppose this is antidiuretic hormone, if there is like increase of antidiuretic hormone, then that like a pathology will arise, that is syndrome of inappropriate antidiuretic hormone. This is I just made it in an like upward arrow to just let you know. Then another one, if this antidiuretic hormone decrease, there can be diabetic insipidus. Okay, so this like syndrome of inappropriate antidiuretic hormone, the treatment will be, we have to decrease or inhibit this antidiuretic hormone. Okay, because excessive of it causing this disease, so we have to decrease it. That is the treatment. Then in case of diabetic insipidus, because this hormone is decreased, that's why there is diabetic insipidus, so we have to increase this hormone. This is antidiuretic hormone, or the drug name is like by the pressin, ending with pressin. For example, there is vasopressin agonist. Okay, now vasopressin is what? It is an antidiuretic hormone. It will act both on V1 and V2. Since it is acting on V1, it will call vasoconstriction. Okay, and if it's acting on V2, it is acting on V2 also, so it will save the water, okay, through aquaporin. Okay, another one is like terlipressin. It will act V1 and it will cause vasoconstriction. That's why these are the drug of choice for the bleeding esophageal varices. Okay, when there's like esophageal varices and there's bleeding, so that time there's like vasodilation, so for the constriction we can prefer this like terlipressin. Okay, then another drug is the desmopressin, which is like V2 agonist. Okay, and it is a drug of choice for the treatment of central or the neurogenic diabetic insipidus. Okay, also it is used in children for the nocturnal enuresis, means night urination, when the child is sleeping and he is urinating at night. Okay, that condition, then also we can give this desmopressin V2 agonist. Okay, then the last one is the vasopressin antagonist. That is like ending with veptans. For example, tolvaptan. It is a drug of choice for syndrome of inappropriate antidiuretic hormone, but one side effect of the drug like tolvaptan is that it is hepatotoxic. Okay, thank you guys, hope you like the video. 1 minute, I will just show you this. You can take a screenshot if you want. Then this one also here, you can just take a screenshot if you want. Yeah, then last page is this one.